At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Center.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. As I like to start off each and every week, I'd like to say hello to all our loyal listeners. Of course, thank you for listening each and every week, and a special hello to anyone who is new to this radio show. This, again, is BackTalk. With myself, Dr. Peter Pedduzi, we're on every Wednesday morning on KHB 6:20 a.m. from 9 to 10 in the morning, as I do quite frequently. Again, I'd like to say hello to everyone who listens each and every week. Thank you for listening and staying loyal to the show. If you are new to the show, typically in the first half hour of the show, we typically talk about the very unique and wide variety of treatment options we offer all under one roof right here at the American Back Centers. And we've been doing it now. Dr. Miskovich started this practice over 49 years ago now, almost 50 years. He started this practice. He's been in the local Wexford area in the last 20 years. In 1994, when that groundbreaking research, which we touch on this show all the time, by two neurosurgeons and published in the Journal of Neurosurgery, and for the first time showing that a non-invasive, non-surgical medical device could produce negative pressure, creating a vacuum with the potential of pulling the disc material off the nerve, relieving your sciatica, opening up that spinal stenosis, taking the narrowing away, taking the disc and putting it back where it should, relieving the inflammation and the swelling, but also allowing for the flow of nutrients and oxygen back into that compressed disc. And that's really the cause of the majority of these problems is the compressed disc. And that's not being addressed with pain medication, epidurals, pain shots, even surgery. As they snip off a piece of the disc or take off a piece of the bone, it's not really addressing the compression problem. Fusion, of course, does. Rods and screws, we know, is very, very invasive. The fusion surgery, we know the problems with that. The areas above and below have to compensate from that lack of movement when you're fixing a segment. And we see the complications, the permanent complications that can result from this surgical procedure called spinal surgery, whether it's in the neck or in the low back region. So back in 1989, when the VAC-C was developed by Dr. Alan Dyer, who was the former Deputy Minister of Health of Ontario, Canada, he himself had a disc problem. He saw the lack of success they had even back then, developed this machine with the help of other doctors, engineers at major hospitals, put it on the market in 1989, and slowly but surely it gained acceptance, especially up in Canada first. A lot of the NHL hockey players, including Mario Lemieux, received VAC-C and took care of their disc problems. Dr. Dyer took care of his disc problem himself. Dr. Dyer, again, former Deputy Minister of Health, the inventor of the VAC-C treatment table, as well as played a part in the invention and the development of the heart defibrillator. It's a very intelligent man, put this on the market, saw the problems, cured his own disc problem, saw the problems with back surgery, and saw a true solution, alternative to back surgery, very safe, effective. Then the research was done back in 1994, as I mentioned, published in the Journal of Neurosurgery. With real-life subjects, they used pressure sensors, showing that each time the subjects underwent VAC-C therapy, the pressure within the disc reduced to almost a negative 200 millimeters of mercury, creating that suction, that vacuum environment of negative pressure, reducing the pressure in the disc. Unlike traction. Traction was used for many, many years. Now, to date, there's still a lot of copycat machines that have come out calling themselves spinal decompression, disc decompression, IDD. I've heard neutrodismosis. They hear a lot of names, and when you call these facilities and you ask them, what exactly are you doing, they may give you a name of a procedure, but they won't give you the name of the actual device. And the question always is, what are they trying to hide? And with VAC-C, you'll always know it's a VAC-C table because Vaxcy's been around for 20 years, has the research, has the documentation. It's going to be around for another 20 years because it works. And we're seeing approximately 3,000 patients a day currently being treated with Vaxcy therapy at over 300 facilities. No other so-called traction decompression device can claim anywhere near those numbers. Again, Vaxcy started with that great research back in '94, published in the journal Neurosurgery. Since then, they've done many, many research studies, independent studies, as well as Vaxcy themselves, proving the effectiveness of this wonderfully FDA-approved, safe, clinically proven treatment. We offer it right here at the American Back Centers since 1994 as well, when Dr. Miskovich purchased 2 tables. And we've upgraded and got newer tables since then, and we still have 2 tables right here at our Wexford location, helping people heal discs without surgery. And even if you've already had back surgery, in many cases we can still help you. And the only way you would know is by coming in, bringing in your films, MRI, CT. If you need a new one, we can prescribe you or give you a prescription for a new one and get another one done to make sure we know what's going on back there. Of course, we're going to do a detailed history, physical exam. Look at the films if you have it before we determine if you are a candidate for this therapy. And if you are a candidate, you have a remarkably high success rate, over 92% success, if we accept you for care. And again, we are very picky. We've been doing this for a long time. We're one of the most experienced facilities in the country instituting this type of care. So we're pretty good. We're not trying to toot our own horn, but we've been doing it a long time. We've perfected our unique American Back Center protocols, which are unique to our office, and we think we do a pretty good job. And you can see the success across the country. There's medical doctors, orthopedic surgeons doing this in their private practice. There's a few hospitals, physical therapists, and chiropractic physicians all accepting and using Vaxcy as the best, most effective, most researched treatment option out there. Please don't be fooled by some of these other TV, radio advertisements you hear advertising these so-called disc treatments. If you want something that's backed by clinical research, it's been around for a long time, continues to help people, again, accepted by all specialties, then Vaxcy is definitely the best pick for you. Very safe, very effective. It's been around for a long time, will continue to be around, as I mentioned, because it works. And it's backed by real science with real results. We'll talk about some of the other procedures we offer here at the American Back Centers here in a few moments, because we do offer a lot of services under one roof. But our primary specialty is, again, we've been known as a disc specialty center, Pittsburgh's disc specialty center, now for over 20 years, because we've been helping so many people, thousands of people over those years, avoid back surgery. And people have already had back surgery or neck surgery. We'll talk about the cervical treatments we offer. We can help as well. And we always say, at least get a second opinion before you undergo the knife, the first, the second, the third, or fourth time. You see in the news, I talk about it on this show frequently in the last few weeks, Tiger Woods, 4 failed back surgeries. Now he's addicted to opiates. Don't let that be you. Don't let your friend, your relative neighbor end up like that. That's horrible. Young man was such a great athlete, and now look where he's gone. And it's very terrible to see, and it's sad. It really is, and it can happen to the best professional athlete. It can happen to you, especially if you continue to take the pain meds, epidural pain shots. They are very addictive. You can see what can happen with even 4 surgeries. Each subsequent surgery, as we talk about on the show all the time, has a lower success rate than the first. So at least for the first surgery, not a very good success rate, but better than the second, third, or fourth or subsequent surgery, as we all know. In the second half hour of the show, definitely stay tuned for that. We always pick out a nutrition topic. We've been talking about various topics the last couple of weeks. Drug driving, which kind of correlated to Tiger Woods. He was actually driving drugged, not drunk. Some of the household factors that influence your cancer risk, we talked about that. We talked about cell phone use, dangers and such. Last week we touched on how to recognize nutritional deficiencies. We're going to finish that up today. We have another article. A lot of this, I should say, some of these items, which I'll be touching on, banned foods and their health risk, you may know, but it's good to remind you, and there's some on this list of 10 that you may not be aware of. So these are actually banned foods that every American should stop eating because it's, for whatever reason, it's not banned in the U.S., but it's banned in other countries. So we'll touch on that here in the second half hour of the show, so definitely stay tuned for that and making sure you're not eating these foods that are definitely not good for your health. And then into next week, I mentioned we're going to do something in the fitness realm because we've been doing a lot of nutrition, and I definitely am into fitness and health. And we'll probably have our topic more geared toward fitness, so definitely stay tuned for that next week. Okay, so of course, as always, the American Back Centers, we are not your typical chiropractic office. Since 1994, as I mentioned, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, bulging disc, failed back and neck surgery, sciatica, stenosis, degenerative disc disease, and other serious health-related issues. So we've been doing this again for a long time, and we have the best treatment options with VaxD. It's a time-tested treatment, very safe treatment. As I mentioned, used in over 300 facilities worldwide, hospitals, medical clinics, orthopedic surgeons in private practice, physical therapists, chiropractic physicians using this, approximately, again, 3,000 patients a day are being treated with VaxD. Again, none of these so-called decompression disc treatments can claim this, even close to that. VaxD is so far ahead when it comes to the amount of patients that are being successfully treated each and every day. And this is worldwide. So as I always ask, if you're out there listening, you yourself or you know someone who's suffering from these type of problems, acute or chronic back pain, you're contemplating back surgery, you're going to a pain clinic getting pain shots, epidurals, you're on pain medication, you're going through physical therapy. It may not be working for you for this type of problem. You were diagnosed with a disc problem, degenerative disc disease, bulging, extruded disc, herniated disc. Been diagnosed with spinal stenosis, sciatica, foot drop. These type of issues are very commonly seen here at our office. And again, the only way you will know if you're a candidate and you will do well with VaxD is by coming in and talking with us. We do offer a free consultation. We'll go over, do detailed history, neurological and physical exam. Of course, look at your films if you have them. Bring them in with you. And we'll go over all that with you and determine if you would be a candidate for the VaxD or any other treatment options we're going to be mentioning here in a few moments. So if you have back or neck pain, unresponsive to your current treatment, you want to avoid pain medication, as we just talked about, the possible addiction involved and damage to the body, pain clinics, epidurals, pain shots, which, again, symptomatic relief, not really addressing the true cause of the issue. You want to avoid surgery. You want a second opinion, or you've already had a surgery that did not work for you, and you're getting worse. Your symptoms are radiating and your hip buttocks growing down your leg. Numbness, tingling, foot drop, weakness. You may be a candidate for the VaxD therapy. Again, don't let somebody tell you that surgery is, 98% successful, whatever it may be. In many cases, those success rates are fabricated, in my opinion, because in most cases, if somebody goes in there and gets a surgery, they may have some relief for a week, a month, maybe a year, and then it's only a matter of time, as we talked about, as they just snip off a piece of the disc, the compression is still occurring because it's not being addressed. The bone spurs, if they're there, will get worse and continue to their progression of fusion. And eventual compression and desiccation of the disc will continue to occur. And it's only a matter of time till you have symptoms again. And we see this commonly. That's not including the possible permanent complications, scar tissue, infection, bleeding, blood clots that you can receive with any surgical procedure. And it happens every day with surgery. Blood clots, which can kill you, cause a stroke, infection, bleeding. It happens. So again, permanent procedures with possible permanent complications, you don't have that with VaxD, because VaxD is, again, is very safe, clinically proven, non-surgical, non-invasive disc treatment. So a little bit more about VaxD. As I mentioned, we talked about how the VaxD was invented and how Dr. Dyer actually played a part in the research and development of the heart defibrillator as well. So this was done over 20 years ago. It was put on the market, and thousands of patients since then have undergone VaxD therapy protocols across the country at over 300 facilities. So again, the unique vaccine treatment table is protected by patents issued worldwide now. So we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now into the future. Again, don't wait until your condition worsens. Call us today. We do have a toll-free number, 1-888, so it's not 1-800, it's 1-888-222-8293. Again, 1-888-222-8293 or 724-935-3300. If you have any questions for me, we do have open phone lines. Feel free to call in and talk about anything you would like pertaining to your back, neck, any musculoskeletal issue, or any nutrition-related question. Feel free to call in. We have open phone lines, 412-825-6262, 412-825-6262. And again, if you'd like to schedule a consultation, you have a couple ways. The toll-free number, the 724-935-3300 number, or you can go on our website and actually request an appointment right on the website. Our web address is www.americanback, B as in boy, A-C-K, centers, with an S, AmericanBackCenters.com. So again, www.AmericanBackCenters.com. Also, if you'd like to fax over any reports, we encourage this, especially if you're coming from a great distance. We do have a list of hotels on our website for overnight lodging. We do have a lot of people coming from out of state, all over, for this unique treatment called VaxD. Talked about how we've had celebrities and professional athletes here at our office. And because they see the research, they see the effectiveness of this wonderful procedure called VaxD therapy. So our fax number, if you'd like to fax over any reports, again, this is the typewritten report. It typically comes with the X-ray or the MRI. If you don't have it, you can just remember where you had it done at, call that hospital or facility, and in many cases they can just fax it over for you directly to our office. Our fax number is 724-935-3321, 724-935-3321. If you'd like to fax over any reports, make sure you put your name should be on the report. Make sure you put your phone number on there so we can call you back and discuss it, especially if you want us to look at it before you come in for your consultation. The VaxD, again, is a medical procedure, the only FDA-approved, safe, clinically proven, non-surgical GIST treatment used by MDs, DCs, orthopedic surgeons, physical therapists worldwide. We also offer a cervical disc treatment. If you have a disc bulge, herniation, degenerative disc disease, posterior facet syndrome, or failed neck surgery, you're contemplating neck surgery, you want a second opinion, you want to see if we can help you before you undergo the knife and have to deal with those possible issues that occur with spinal surgery, give us a call. We have a great treatment called cervical decompression, including if you have cervical radiculopathy, if you have numbness, tingling in your fingers, hands. We're able, in many cases, if not all cases, if we accept you for care, to pull open those foramen, take the pressure off the nerve, and relieve the numbness and tingling, the weakness that is experienced commonly with people coming into our office with cervical radiculopathy, numbness, tingling, carpal tunnel. Many of those issues are addressed very effectively, as well as the disc problems in failed neck surgery here at our office. So if you have those type of issues, you know someone, tell them to give us a call, again, 724-935-3300 to schedule a free consultation. We offer therapy and rehab, state-of-the-art facilities, individualized programs, ergonomic and postural instruction right here at the American Back Centers. A multifaceted approach can treat wrist, hand, finger, foot, ankle, and knee problems, including the extremities, examples including tendonitis, rotator cuff, carpal tunnel, and frozen shoulder, amongst many, many more. People are coming in each and every day with scripts from their PCP for therapy. We can, of course, do that right here at our office. Deep tissue massage, myofascial trigger point therapy, reflexology, done by a licensed massage therapist, comprehensive nutritional consultations, custom-made orthotics. We have a nice 3D digital scanning system for the foot, assessing for foot dysfunction. I think you'll be very impressed by this. It gives you a nice color printout of the foot and any possible dysfunction involved with that. We have in-house X-ray, nerve conduction testing, done right here at the American Back Centers by an outside facility, Lakeside Medical. The X-rays are done right here. and a nerve conduction test is done by the outside facility. We have a convenient MRI CT facility right across the street, so if you need that, you can go right across the street and get that done. And I'm a certified personal trainer, so I can help you get back into the gym and do things correctly, as I talk about on the show all the time, without hurting yourself. So in addition to being a doctor of chiropractic, of course, I can help you as a certified personal trainer as well. So as we talk about frequently, our protocol here with VaxD is physician-directed. Our protocol engages other modalities on a case-by-case basis. We have over now 20 years of experience, one of the most experienced facilities in the country instituting this type of care. And we screen out and decline candidates whose medical records, of course, and evaluation indicate we're unlikely to help them. So, of course, if we can't help you, we're going to send you out to the appropriate specialist. And a little bit about the VaxD, if you are new, the VaxD treatment table and computer. So it is a computerized treatment, automated treatment, work with each individual patient, adjusting back tension, which in turn adjusts interdiscal pressure. That's pressure within the disc. Moment by moment, the computer adjusts the tension in small amounts so that the muscles in the lower back do not spasm or contract during treatment, which allows for the treatment to take place in true opening of the decompression of the disc in the spine. So if you'd like to receive a free consultation at no cost or obligation, of course, we're going to sit down with you, answer all your questions. We encourage you, bring somebody in with you, spouse, family member, neighbor, friend, somebody to drive you out here for your initial consultation. It's helpful. It's not essential, but we recommend it. Answering all your questions, doing a detailed history exam. We encourage you to bring in your films, X-rays, MRI, CTs when you come in for your consultation. That just helps us get a better interpretation if you'd be a good candidate for the therapy. And if you are, you have an over 92% success rate. Nothing comes close to that success rate when it comes to these other treatment options we discussed. We also have a free DVD. If you still have a DVD player, and I say that because DVD players are really going on the way out, but you can always throw it into your computer if you have a DVD. This is when Channel 11 did a medical breakthroughs report on our office. They heard about all the success we've been having helping people avoid back surgery with VaxD, and people with failed back surgery helping them after back surgery fails. This is on a DVD, Channel 11 report that interviewed our office. There's some great patient testimonials on there as well, so if you'd like to receive this, as well as a 24-page Keller booklet showing you all the ins and outs of VaxD, just give us a call. We can send it to you. Just give us your name and address, and we'll send it out to you, again, free of charge. We have some research papers. The first paper was published in the Canadian Journal of Clinical Medicine. This research is done right here at the American Back Center, so we're very, very proud of that. And it was done on VaxD, and again, published in a peer-reviewed medical journal. We also have the Knife in the Back article, very popular article. It's been out for many years, showing the failures of back surgery, specifically fusion surgery, why it's such a money-making procedure for hospitals and medical clinics. They continue to do it because they're making tons of money, even though it's not the best approach for chronic back pain because the rate of disability is high. I know it myself with my father-in-law, who has his back fused before he met me, totally disabled, as far as not able to work, not able to cut his own grass because of the fusion and the pain he still experiences. So Knife in the Back article we can send out to you, as well as the article published in the Canadian Journal of Clinical Medicine that was done right here at the American Back Centers. We also have the two free booklets done by attorneys, the blue workers' comp book and the yellow auto accident booklet. The blue book, a great resource for anyone who's hurt at work. So many people, as I mentioned over and over on the show, get taken advantage of by the workers' comp system. They get hurt at work. They don't know their rights. They have no idea. They're told by the insurance company or the employer that they can do these things, and it's, I hate to say it, flat-out lies just to get them back to work and reduce the compensation for the employer and or the insurance company. And many times you make mistakes that actually come back to bite you later on if you do have to sue or go to court to get medical care or get paid for your time off when you're hurt, because their biggest thing is just getting you back to work. In many cases, they have you go to their panel doctors. The panel doctors, in many cases, don't help you, and you're still in pain, or they diagnose you with something less than you really have, like a strained sprain when you really have a disc problem. And if you've been diagnosed with a strain sprain and you think you may have a disc problem, call us. We can order an MRI for you or a CT, depending on your situation, and accurately diagnose that. And then it opens up another can of worms where we actually see the true problem that they've been downgrading. Again, and this is very common in workers' comp and auto cases where the insurance company tries to do that. So this booklet outlines that, and it's a great resource. It's free. Just call for the free blue workers' comp book or the yellow auto accident booklet. Again, we can send it to you. Just give us your name and address. We have great treatment options, rehab, chiropractic, massage, and specific one-of-the-kind disc treatments for the back and the neck that may be involved in a whiplash case if you were in a car accident that has developed into a disc problem now, herniated bulge disc, degenerative disc. If you lifted something at work and you got hurt at work, pushed or pulled. We've had patients that were just sitting and went to stand up and they developed a disc problem at work. So these type of issues can be addressed, and you can come in and see us, especially if they're trying to give you problems. And again, get the free booklets, the blue workers' comp, the yellow auto accident booklet, and schedule a consultation with us. We definitely can help you with these more difficult cases. We've seen some of the most difficult disc cases over the years, and we're very confident that we can help the most difficult cases. But the only way you can know, we would know, is by coming in and scheduling a free consultation. As we mentioned, you have nothing to lose but your pain by coming in and talking with us. As always, I always mention this as well. The real question should be, why would you even think about surgery? When we talk about surgery compared to VAXD, with all its complications and lack of success, we mentioned infection, bleeding, death from a blood clot, from a stroke. When VAXD is an option, VAXD, again, is a non-invasive, safe treatment with a much, much higher success rate than surgery, pain injections, physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner. Remember, VAXD addresses the structural issues, not just the symptoms. Truly decompressing the disc, restoring the fluid content, taking the compression off the spine of the disc, relieving your pain associated with low back pain, disc problems, herniated, degenerative disc, extruded disc, foot drop, sciatica, stenosis, numbness and tingling, and as I mentioned, even failed back surgery cases, without the use of drugs, injections, or surgery. I'm going to give you a quick testimonial. This is from our 24-page Keller booklet that I do encourage you call us, and you can receive it free of charge. This is from a Dr. Wise, M.D., who's a back pain specialist, board-certified neurology and pain medicine, who's on to state, adding VAXD to my practice has been the most impressive and rewarding experience. I have treated hundreds of patients over the years, aged 17 to 84, with this non-invasive, non-surgical treatment. I am thrilled to offer treatment that has led to a reduction of the use of many medications and an increase in quality of the patient's life. So again, this is an original patented treatment used by leading physicians in orthopedic medicine, pain medicine, neurology, other specialties, in hundreds of clinics worldwide. VAXD utilizes a patented technology, which is one of a kind. There's published credibility. There's a medical textbook, which I talked about on this show, The Practice of Minimally Invasive Techniques, published by the College of Physicians Publishing Division. Several world-renowned orthopedic surgeons have contributed to this book, used in medical schools. Chapter 35 of this text focuses exclusively on VAXD therapy. The summary concludes that, quote, VAXD should not be considered traction in the traditional sense, but as decompression. VAXD is the only non-invasive treatment that has been proven to decompress the disc. With other traction devices, there's only been indirect proof. So there's a lot of other so-called treatments out there, and it's important to note VAXD has a research. It has the backing of surgeons, orthopedic surgeons, as well as medical doctors, chiropractic physicians, physical therapists, published in medical journals as well as medical textbooks showing that it's unique and the only device that can actually truly claim decompression, because it actually does what it says it does. Unlike some of these copycat devices out there that make a lot of claims, because the term decompression is so loosely used these days, anybody can call anything. As I mentioned, I've seen pump-up devices you put around your neck or your back. they call that decompression as well, and I don't know how you could possibly call something like that decompression. I'm going to give you another testimonial. This is from a Sarah who received Baxi therapy. Goes on to state, my primary care doctor and the surgeon to whom she sent me both saw surgery is the only way to go. As a physical therapist with 37 years of clinical practice, I've seen my share of failed back surgeries and opted to search out all possible alternatives. By the grace of God, I learned about VaxD. My pain level was a 10 plus out of 10, and I was taking maximum doses of prescription string pain meds. I virtually crawled into the VaxD clinic, hoping for minimal relief. I drove a 75-mile round trip for 6 weeks in order to receive the treatment. Neither the drive nor the treatments were comfortable at first, but well worth the final results. I've done the recommended exercises and followed all the lifting restrictions faithfully and will continue to do so. Being a therapist myself, I realize the importance of maintenance as well as the potential for re-injury as I return to work at this time. My pain now at the end of 6 weeks of treatment with Vaxi is generally at a 0. You can imagine how grateful I am to have avoided surgery, and I'm able to get on with my life and continue working without pain. Another testimonial, this is from a physical therapist that received Vaxi and was told surgery was her only option. So again, don't let a surgeon, don't let anyone tell you that surgery is your only option. That's not the case. We've helped many people avoid surgery, and people have already had failed back surgery. Another quick one from a Christopher. I would still be in pain if it weren't for Vaxi due to a horrible fall. My level of back pain was so tremendous that at times I was unable to stand up or get out of bed. For the first 3 years after the accident, I had 12 different doctors who were trying everything from physical therapy, electric stim, acupuncture, massage therapy, and even surgery. Finally, after 4 long years of therapy that only moderated the levels of pain, I found VaxD. It has practically eliminated the mid to low back pain I suffered. Now, after 6 months, I'm actually becoming part of society again. So, wonderful success stories we see over and over with this wonderful treatment called VaxD. And we have a whole list of testimonials on our website as well. Again, visit our website, www.americanbackcenters.com. Again, www.americanbackcenters.com. VaxD is a primary, non-invasive treatment for low back pain, sciatica, stenosis, herniated bulging disc. A wonderful treatment that has been used all over the world now and is backed by a laundry list of clinical research studies. And it continues to grow more and more and more. Again, VaxD is utilized by leading physicians and surgeons in the fields of orthopedics, neurosurgery, pain medicine, and occupational medicine, and family medicine. VaxD is prescribed all over the world now, and VaxD has been adopted as the primary treatment for the management of chronic disc disease. VaxD therapy is safe, cost-effective, non-surgical treatment that offers new hope for millions of people who suffer from low back pain every day. VaxD celebrates a proud history and commitment to the patients for whom we care, for those whose lives we have forever changed. And we've seen that each and every day with patients. It's wonderful to see the changes that we're seeing every day with patients that come through our door, truly changing their lives. And that's why we get most of our referrals from satisfied patients receiving Vaxi therapy that have done well here at our office. They tell their friends, their neighbors, their relatives about how they've done, and they refer patients to our office, and then that patient becomes a referral source for someone else. And we're seeing more and more, even though the surgeons are being reluctant, referrals from the surgeons now too, seeing that they know that surgery should be a last resort. I've gone to Cleveland Clinic, many other seminars, where they stood up there and stated, exhaust all your conservative treatment options first. They're admitting it as well because they know surgery has a lot of complications and a very low success rate. All right, before we get into our nutritional topics today, if you have any questions, feel free to call us. We have open phone lines, 412-825-6262, 412-825-6262. Also, you can email me directly at Dr. Pedduzi at AmericanBackCenters.com. Of course, visit our website, www.AmericanBackCenters.com. You can take a look at our website, request an appointment right on the website. Again, www.AmericanBackCenters.com. You can subscribe to our daily health update newsletter by scrolling down to the bottom and giving us your name and address and your information. You'll automatically get signed up for a daily health update newsletter, health tips sent to your email, free of charge daily. You'll also get signed up for a one-of-a-kind monthly In Good Hands newsletter by some of the greatest health minds in the country. Contribute to this once a month. It's about 7 to 10 pages. Comes via your email, free of charge when you sign up for the daily health update newsletter. Again, go to our website and do that. You can also find our blog. The blog address is www.drpeterpedduziblog.com. Great information on back pain, neck pain, headaches, and much, much more. Also, the daily health update newsletter has a great quote each and every day. Today's quote is, "Millions saw the apple fall. Newton was the only one who asked why." And there's health tips for mental attitude, health alert, diet, exercise, chiropractic, wellness and prevention, and an inspirational quote each and every day sent to your email. You can delete it. You can pass over by if you don't have time to look at it, or you can look at it. It just takes literally 2 minutes a day if you have time, or you can just skip by it, send to your email, free of charge, and then monthly you get a 7 to 10 page great newsletter. Again, some of the greatest minds from the Cleveland Clinic as well as across the country contributing to this. Great things go into this once-a-month paper, so you get that free when you sign up for the daily health update newsletter. So check that out today, and also you can request an appointment right on the website as well, as I mentioned. So we like to highlight some nutritional products before we get into a nutritional segment. We have a nice product called Caprolix. We've seen great results with yeast infections, candida and yeast infections with this product. So if you have those type of issues, if you like a natural alternative, you can try this product. Just call our office and ask for the Caprolix, the yeast control product. We can send it to you for a small shipping fee, or you can pick it up right here at our office and save the shipping. We have a great product for neuropathy as well as carpal tunnel issues. Ask about that, too. You can call our office, and we can send it to you. You can pick it up. It has a great active formula with B6, vitamin B1, and zinc, and the active form of B6, which works exceptionally well for carpal tunnel, as well as other neuropathy issues. We have another great product, Pro Omega CoQ10. If you're on a statin drug, you want the combination of a fish oil with a CoQ10 in therapeutic amounts, all in one pill, which actually saves you money because you don't have to buy the separate CoQ10 and the fish oil. It all comes in one pill. It's a very popular product. I take it myself, as well as many, many of my patients ask for the Pro Omega CoQ10. We can send it to you again, or you can pick it up right here at our office. One of the more popular items is the L-Arginine Complete. If you'd like to, quote, age-proof your inner body, great way to do this. You're concerned with health issues, including heart health, blood pressure, neuropathy, poor circulation, poor sexual performance, lack of endurance, poor mental acuity, inflammation and fatigue, lack of nitric oxide, according to a Nobel Prize winner, is very, very big problem in today's society. And when you don't produce nitric oxide as we get older, it becomes a problem with blood pressure as well as circulation, as well as neuropathy issues. And when you address this with 5,000 milligrams of L-Arginine combined with 1,000 milligrams of L-citrulline, it does wonderful things in the body for nitric oxide levels. Over 20 hours a day of production of nitric oxide when you take this product. Neuropathy, blood pressure can drop in many cases, as well as we talked about sexual performance, circulation, lack of endurance, improved fatigue, mental acuity, all comes with improvement with nitric oxide levels. So this product does it very effectively. It also has your vitamin D and vitamin K in the appropriate forms. Added to this product, homocysteine, vitamins B6, folate, and B12, as well as a little bit of magnesium. 100% natural product, no artificial ingredients. Comes in a powdered form. You scoop it out and put it into a glass of water. Very natural, very effective. So if you have these type of health issues, give us a call. You can try the L-Arginine Complete. We can pick it up. We can send it to you. You can pick it up right here at the American Back Centers. Finally, we have the Intramax, the all-in-one liquid multivitamin. If you'd like to try that, many peer-reviewed double-blind studies showing the effectiveness of this product. Over 415 ingredients, all in 1 ounce of this product. Carbon-bound organic, 71 organically bound trace minerals, 100% carbon-bound organic, super green foods, digestive enzymes. The list goes on and on. This is a wonderfully complete product. When I show the list of ingredients to patients, they just are amazed by how much is in this product. I tell patients initially you can take it once a day, which is what the bottle lasts, 1 month. Once you get into your system, you're taking it 1 or 2 months. You could probably get away with taking it every other day because it's so complete. It will save you money, so that bottle will now last you 2 or 3 months. So we do offer a $5 discount on your first bottle or free shipping. We're so confident you're going to love this product that we offer free shipping or $5 off your first bottle of Intramax or IntraKid. Ask for the IntraKid. If you're concerned about your grandkids, your children under the age of 18, they have a comparable liquid multivitamin called IntraKid. As we always talk about, these big pills, these Flintstone vitamins, are artificial. They're garbage. They're made by pharmaceutical companies. 1 a day, Centrum. But especially for the kids, the Flintstone vitamins, in many cases, are causing more harm than good because of the artificial coloring, the Splenda, the artificial sweeteners that are added to these products. They're not good. And a liquid multivitamin is so better absorbed. You're getting what you're paying for. You get that with the IntraKid for the kids, with the Intramax. If you have grandchildren, you want them to be on a good multivitamin, call us and get the IntraKid today. All right. Before we get into the nutritional segment, I also want to remind you we do offer another service. It's called kinesio taping. And if you see the colorful tape that some people may have on their knees, ankles, any type of extremities, you can do it on the neck, the back. It helps to support the muscle, remove congestion, corrects joint problems, activates the lymphatic system to remove waste, reduce inflammation, reduce pain, remove excessive heat and chemical substance from the body, reducing inflammation, as we mentioned, improving blood and lymph circulation, increases range of motion, avoids injuries and cramping, increases the overall success with our treatment, training, and rehabilitation. It's called kinesio taping. It's very safe, it's painless, and it's something else that I'm certified in, and we offer right here at the American Back Center. So if you'd like to try the kinesio taping, very quick, very effective, completely safe, call our office, and we can do that in conjunction with anything else we're doing here, or you can just try just the kinesio taping. Also, a reminder, we also offer the LipoLite, the non-invasive, non-surgical light therapy that actually shrinks the fat cells in certain areas that you'd like to try, whether it's the waist, the love handles, the back of the arms. Patients have had great success with as little as 6 treatments with this therapy called LipoLite, completely safe, no surgery involved, and extremely effective. Patients are seeing anywhere between 1 to 3 inches of loss. They're losing dress sizes, losing shirt sizes. If you're a male, you can definitely get it. If you're a man as well, very effective. It's called LipoLite. If you'd like to try the LipoLite procedure, call our office today. All right, so we're going to be touching on what are the banned foods and their health risks. So the 10 banned foods that every American should stop eating. This is from Mercola, MERCOLA.com. I want to remind you can go to our Facebook page, American Back Centers Pittsburgh, and check out our Facebook page. And you can actually see, we try to put on the health articles we're touching on BackTalk on the Facebook page. So if you need a copy of it, just go and print it off from the American Back Centers Facebook page. If you don't have a computer or printer, we can send it out to you free of charge. We ask only if you don't have a computer, internet, or printer. Request that. We can do it for you free of charge. We don't want to be sending to everybody, but we may try to make it easy for you. You can go to his website, Mercola.com, and find the article, or go to our Facebook page and just print it right off the Facebook page. If you have a second, we would encourage you to like our page. It just takes a second to do that. And print off the article, again, today's article, 10 banned foods that every American should stop eating. If you want anything else from previous BackTalk episodes, you can see that on there. We've been doing it for probably 6 months to a year now, so it doesn't go back all the way, but it goes back about 6 months to a year with the health articles that we've been touching on. So number one on the list, you may know this, but it's worth reminding, farm-raised salmon. Raised wholly on unnatural diet of grains, including genetically modified grains, with a concoction of toxic antibiotics, vitamins, drugs, and chemicals not safe for humans. So while farm salmon is much fatter than wild salmon, it contains 50% less healthy omega-3s than wild-caught salmon. Farm-raised salmon has higher levels of PCBs, as well as other toxins, including mercury, than wild-caught salmon. Farm salmon do not have a pinkish-red color as wild salmon, and has to be fed with a synthetic product to make that pinkish-red color. Farm salmon are likely to get infected with lethal fish viruses, including infectious ISA virus, as well as other viruses, so it's definitely something you don't want to be eating. So always, always, always wild-caught salmon, not farm-raised salmon. Make sure, especially when you're out at a restaurant, that you ask, is it wild-caught or is it farm-raised? Because in many cases it will not be on the menu. So 90% of toxins from farm-raised salmon can bioaccumulate in your body and can be passed on to your firstborn and expelled later on through your breast milk. So this is actually banned in Russia as well as Australia. It was actually banned back in 1975, over 40 years ago in Australia, and just recently in Russia, where farm-raised salmon is actually banned now. So it's important. A lot of people think just because I'm eating salmon, I'm doing good, it's healthy. If you're eating farm-raised salmon, it's actually worse in many cases than eating hamburgers and such because of the contaminants we just mentioned. So make sure, again, it's wild-caught salmon. Number two, genetically engineered papaya. Most Hawaiian papaya is now genetically engineered to be resistant to ring spot virus, a threat that devastated U.S. crops in the 1990s. So animal-fed GE foods, genetically modified foods, suffer a wide range of modalities, including intestinal damage, organ damage, tumors, possibility, birth defects, premature death, and near complete sterility by the third generation of the offspring. So it's actually banned in the entire European Union, but not here in the U.S., unfortunately. Next, number three. I'm going to try to pronounce this right. I apologize if I don't. Ractopamine tainted meat. And in the U.S., ractopamine is currently used as a muscle enhancer in 45% of pigs, 30% of cattle, and an unknown percentage of turkeys. So it's not a good thing. It's banned in Russia, mainland China, and Taiwan, but not in the U.S. still. Ractopamine is linked to reductions in reproductive function, increase in mastitis in dairy herds, increased death and disability. Is known to affect the human cardiovascular system, causing hyperactivity, chromosomal abnormalities, as well as behavior changes. Number four, flame retardant in drinks. Brominated vegetable oil, or BVO, originally patented by chemical companies as a flame retardant, is also found in citrus-flavored sodas and sports drinks in the U.S. Guess where it's found? Gatorade, Powerade, Sunkist, Mountain Dew, Fresca, Squirt, and Fanta. Approved in 1997 by the FDA, BVO has been shown to bioaccumulate in human tissue and breast milk. Animal studies have found that it causes reproductive and behavioral problems in large doses. So again, you should avoid it because it's banned everywhere in Europe as well as in Japan. But guess what? It's not banned here in the U.S. May be linked to birth defects, growth problems, schizophrenia, as well as hearing loss. Competes with iodine receptors in the body, which can lead to iodine deficiency, hypothyroidism. So if you're drinking a lot of Fanta, Sunkist, Mountain Dew, Gatorade, Powerade, these type of citrus or sports drinks, you're wondering why your thyroid's not doing well. Well, that could be contributing to it. This BVO, flame retardant, number 4 on the list. Number 5, processed foods with artificial food colors and dyes. More than 3,000 food additives, preservatives, flavoring colors, synthetic ingredients are added to U.S. foods, usually found in like goldfish crackers, cheese-flavored crackers, the Cheez-Its, Goldfish crackers, mac and cheese, Jell-O, and other cereals for kids is where this is found. Risks include research linked to rainbow of additives, behavioral, cancer, birth defects, as well as allergy-like hypersensitivity. It's actually banned in Norway and Austria, but not in the U.S. Arsenic-laced chicken. Chronic arsenic exposure can lead to anemia, headaches, skin lesions, low blood pressure, low IQ, kidney damage and failure, increased risk of diabetes, miscarriage, stillbirth, low birth weight, and infant mortality. It's banned in the European Union, but it's still here in the U.S., making the meat appear pinker and fresher, makes the animals grow quicker. So it's used in animal feed in the U.S., arsenic-based drugs. In 2011, Pfizer announced it would voluntarily stop marketing Roxone, although there are still several arsenic-based drugs on the market. Number 7, bread with potassium bromate. Brominated flour is enriched with potassium bromate. I think we saw that with Subway, and they actually got that off. It's no longer in the Subway bread. Commercial baking companies claim it makes the dough more elastic and better able to stand up to bread hooks. So you'll find this in wraps, breads, rolls, breadcrumbs, as well as bagels and bagel chips. It's actually banned in Canada, China, and the European Union. Potassium bromide has been linked to kidney and nervous system damage, thyroid problems. Again, if you're having a thyroid issue, this could be contributing gastrointestinal discomfort as well. Number 8, Ostra, or Olean, created by Procter & Gamble, is a calorie and cholesterol-free fat substitute used in fat-free snacks. It was approved by the FDA in 1996. Time magazine named Ostra as one of the worst 50 inventions ever, usually found in French fries and chips. Rats fed potato chips made with Olean gained weight. Adverse intestinal reactions to the fake fat include diarrhea, cramping, leaky bowels, anal leakage. It is banned in Canada and the United Kingdom, but not in the U.S. Number 9, preservatives, BHA and BHT. Toxic preservatives found in beer, breakfast cereal, butter spread, nut mixes, meats, chewing gum, dehydrated potatoes, so like your instant potatoes, dehydrated butter spread, as opposed to the stick of butter. We're talking more of the spread butter, breakfast cereal, beer, nut mixes. BHA can trigger allergic reactions and hyperactivity and can also cause organ system toxicity. Banned in the European Union and Japan, but not in the U.S. And finally, number 10, milk and dairy products laced with RBGH, synthetic version of natural bovine hormone producing cows' pituitary glands to increase milk production. Our friend Monsanto developed the recombinant version from a genetically engineered E. coli bacteria and marketed it under the brand name Prolax. Approximately 1 in 6 dairy cows are repeatedly injected with growth hormones, so it's found in many cases in milk and dairy products, including cheeses, milk, and any type of dairy product. It's actually banned in many countries, Canada, European Union, Israel, New Zealand, and Australia, but again, not in the United States. Unfortunately, RGBH, exposure can cause colorectal, prostate, and breast cancer. These cows actually suffer at least 16 different adverse health conditions, including high rates of mastitis that contaminate milk with pus and antibiotics, and we're drinking it. And it's still not banned here in the U.S., believe it or not. So hard to believe, but again, these are 10 banned foods across the country, I should say across the world, that every American should stop eating that are not banned here in the U.S. So again, many foods sold in the U.S. are already banned in other countries due to these harmful additives, growth promoters, genetically engineered ingredients, and other dangerous practices. But why are they not banned here? That's a good question, but they're not. So it's a nice list there. Again, if you didn't have time to write it down, you can go to our Facebook page, American Back Centers Pittsburgh, and print it off right from the page. You can take a look at it. If you want to print it off, you can print it off. Like our page while you're there. It just takes a second to do that. You can friend us as well if you want. Friend our page. Again, American Back Centers, Pittsburgh. Again, also remember to visit our webpage, www.americanbackcenters.com. You can request an appointment right on the website. You can go on there and check out what we do, all the services we offer, all under one roof here at the American Back Centers. We talked about the cervical disc treatment options, the VAX-D for the lower back. We have many things we offer here, the LipoLite procedure for non-invasive slimming, shaping, and toning, if you like to fit into a swimsuit in a very safe way, very effective way. We have nutritional consultations. We have the custom-made orthotics, where you're getting a 3D digital scan. If we see those problems, it's sent electronically to the company that makes them, and it takes about 5 to 7 business days to return to our office with a custom-made orthotic, custom to your particular problems. We have many great services, including therapy and rehab for any type of issue, musculoskeletal issue, foot, ankle, knee issues. We treat those issues very effectively with our therapy and rehab right here at the American Back Centers. All right, we are short on time, so as always, we give you some final closing thoughts before we adjourn for the week. Again, as always, remember to do your homework before pursuing any treatment option. Ask for the research. Go on the Internet. Unfortunately, there's many people out there trying to scam you. With VAX-D, you don't have to worry about that. We have a proven track record, time-tested treatment, very well-researched treatment used worldwide. Over 3,000 patients a day at over 300 facilities are using this therapy. MDs, orthopedic surgeons, physical therapists, chiropractic physicians, all specialties accepting this care as the best non-invasive treatment option to surgery. Accepted by all fields of healthcare, as I mentioned, most importantly, it's something that actually works. With VAX-D, the results speak for themselves. VAX-D is backed by real science and real results. I want to thank everyone for listening today. We'll be on next Wednesday and every Wednesday from 9 to 10 with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to BackTalk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for BackTalk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.